meeting is being recorded. If you have issues with being recorded, please feel free to stay off camera or join us on camera if you would like to join the group so we can see your beautiful face. We are going to start with some introductions this morning. Let me get a couple of housekeeping announcements out of way. We have had a couple of requests for signage that we used to house on CoHealth Resources. So we're changing that vendor to a new printer, and the signs will not be available until September. What I have now is the template. So if you have a property that needs signs before September, which you probably will, you can take the template and you can design signs for your housing provider based on the template. Now, the good thing about this is you could possibly, if you're designing those, you could possibly put their logo on that with the sign with ours, and that would be a nice opportunity. But the problem with that, guys, is that the funds for that is not available. So you'd have to pay for those funds out of your step dollars, but those have been approved. So if you do need signs, let me know. I would like for you to have at least one hard sign so you can show to housing providers if you're doing some community engagement and you want them to kind of see what you have. So if you have any questions about that, please let me know. That's fine. So a second announcement is I have this this interesting opportunity to present at the Housing Now conference, and it is in October, and it's in Keystone this year. What we do at the conference is we have panel discussions. So what I'm looking for is 4 grantees who are interested in writing a RFP with me to talk about how we handle secondhand smoke complaints in each county. This will give our housing providers kind of a comprehensive idea about what we do and then how it is specific to counties, and an opportunity for you to connect to housing providers in your county as well. So I will be sending that out to some people which I feel like are appropriate for this. I think everyone's appropriate for this if you're interested, but I will, if I don't get any people interested, I will be reaching out and volunteering you myself if you're interested. Okay, that being said, one more thing and then we'll get started. So we all know that evaluation is part of our, we have to deliver evaluation on almost everything we do. So I do have a pre-post for my session 1 and session 2 trainings that if you attended, I'm going to send out that evaluation link today. I have plenty of what I don't have is my post. I only had 5 people respond to the post, and that's really important for me to gauge the learning and the knowledge gained from session 1 to session 2. So when I send that out, I'm going to specifically only send it out to folks who attended session 1 and session 2. And if you've already done the post survey, don't do it again. But if you haven't done it, would you please provide me that information? That would be very helpful. And then finally, session 3 is coming up. Session 3 is going to piggyback a little bit on what Teddy's going to present on today. We're really advancing now into these deeper practices and this deeper support of secondhand smoke for these secondhand smoke complaints. So we want to make sure that you are caught up, but you're also ready to advance and understand that these are only suggestions and recommendations. These are not strategies that you have to choose or you have to take. So that last training, session 3, is May 21st. And that session is going to talk about reasonable accommodations. So reasonable accommodations are an important way for us to help our residents when we don't have policy, larger policy. And then we'll talk about mediation as well. So it should be very interesting. And the last 45 minutes of that training are going to be reserved for a little bit of workshop and conversation about how do we deal with HOAs. It's because there's owners and there's renters. There's different protocols for each. So that being said, I do believe Teddy's going to clear up a lot of that for us today. Let's go ahead and just do a round robin of introductions. I'm going to go ahead and just do you as I see you on my screen. And this is just important that we get a kind of a visual with your face and your name, especially for me. Okay, so I've got E. I think that's Emily Cowett, Adams County. Okay, moving on. Giovanna.
Sorry. Did you say E Cowett? That's me. I'm Erin Cowett, and it's
Erin,
Alamosa County. I can turn on my camera for a minute if you want. Sorry, I'm just Alamosa County. I put my camera on for just a second. My camera is kind of in a weird spot. So I work at Alamosa County Public Health Department. I am the STEP grant leader there. And I am trying to find out more about the smoke-free housing complaints and kind of what I can do. I don't know if that's what you kind of wanted me to say.
That's fine. Yeah. I mean,
Okay.
it's great to see you because I do have some stuff in Alamosa County that I wanted with a housing provider. I wanted to talk to someone down there about. So I'm going to email you after this learning community call and just kind of share with you this project that I have that would involve Alamosa County Housing Authority. So it's really nice to meet you. Thank you so much for joining us today. And Giovanna, is that right? No.
Good morning. Yeah, you said it right.
Okay, good.
Nice to see everybody. I'm Gio. I'm from the Weld County Department of Public Health and Environment. I am the Youth Tobacco Education and Prevention Specialist and Tobacco Free Schools Coordinator.
Great to meet you. Hazel.
Good morning. I'm Hazel Starkevich. I work out of Arapahoe County Public Health, and I'm the Community Engagement Specialist for tobacco. Yeah.
Thanks, Hazel. And Pete. Pete, you're muted.
Yeah, I know. Pete Bialk with GASPA Colorado, the group to alleviate smoking pollution.
Thank you for joining us.
Subcontractor with Denver Public Health.
Thank you for joining us. Brittany.
Okay, sorry, I had to find my mic. I'm not used to Teams.
That's
So
okay.
my name is Brittany. I work at the Northeastern Colorado Health Department, and I'm a community health specialist.
Perfect, Brittany. Thanks for joining us. Nikita.
Hi, everybody. My name is Nikita. I work at the Pueblo Health Department. And yeah.
Thank you. And Nikita, I do want you to consider that invitation that I mentioned earlier today with the conference. You know I did. You know I wanted to. Bianca.
Hello, good morning, everyone. Bianca Garcia with Denver Department of Public Health, Tobacco Program Analyst over secondhand smoke.
Thanks for joining us, Bianca. Lucy?
Hi, I'm Lucy Luna from Northeast Colorado Health Department, and I am the community health specialist in the tobacco program.
Thanks for joining us, Lucy. And then I have Bree.
I'm Bree. I'm with the Northeastern Colorado Health Department. I'm a community health specialist in the tobacco program.
Thanks for joining us, Bree. Taylor?
Hello, I'm Talia Honstead. I work with Northeast Colorado Health Department. I'm the Health Promotion and Prevention Manager.
Hey, if there was an award today for public health department's attendance, it would be your department today. Thank you all for joining. There are no awards, but I'll send you a cookie. And then we have Raya.
Oh, hi, everybody. My name is, let's see if you can get my face. Here we go.
There you go.
My name is Raya McIntyre. I am the Smoke-Free Policy Specialist at CDPHE. So I work closely with Peggy for smoke-free multi-unit housing.
Thank you for joining us, Raya.
Raya,
Absolutely.
hang on one second. Raya, is it your birthday today?
Yes.
Aww.
Yes, well, happy birthday from everyone.
Thanks, Teddy.
Happy birthday.
Happy birthday,
Teddy
Raya.
stole my thunder. I was going to say it.
Thanks,
Teddy,
guys.
Angie
Really
was
nice.
going to. Happy birthday,
okay.
Raya. I was going to let Angie say it.
Oh, Angie, I just got your text, so you beat Teddy to that at least.
And then I have a thank you for joining us, Raya. I know you're busy. And then we have the 970-388 number. Is that, oh, that's probably, okay. I know that's Michelle probably. Angie?
Hi, it's Michelle at Adams. Sorry, I had to just call in today.
No, it's okay.
Great to hear everybody's voices and happy birthday, Raya.
And Angie?
Hi, everyone. I'm Angie Kogosic, and I'm the Tobacco Program Supervisor here at Denver Department of Public Health and Environment.
Thanks for joining us, Angie. Kimberly?
Hi, I'm Kimberly. I'm the Health and All Policies Coordinator at Larimer County Department of Health and Environment.
Thank you for joining us. Lee?
Hello, I am Annalie Kravik with Lincoln County Public Health, and I am the sub-grantee and the program specialist.
Thank you for joining us. Chelsea? It's Casillas from CDP. Oh, from CDPHE. Hi, Chelsea.
Hi.
I've seen you on emails, but I've never met you. So
Yes.
maybe I've met you in a meeting or two. Yeah, introduce yourself.
Nice to meet you, Peggy. First, happy birthday, Raya. Second, I'm Chelsea Casillas. I'm the Tobacco Treatment Initiative Specialist on the STEP team. So I'm on the cessation side, but really just wanting to learn a bit more about smoke-free complaints. So that's just here for educational purposes.
Okay, perfect. Thank you for joining us. Always open to new learners. Veronica.
Hi, everyone. I'm Veronica Mendez, one of the prevention and policy specialists in El Paso County Public Health, and I lead our smoke-free public spaces work.
Perfect. And Teddy.
Good morning, everyone. Teddy Montoya, Tobacco Program Manager here at DDPHE.
And Laura.
Hi, I'm Laura Starter. I'm with Fremont County Department of Public Health and Environment, and I'm the Tobacco Education and Prevention Coordinator.
Perfect. Thank you for joining us. Good morning, Tiffany. Would you like to introduce yourself?
Good morning. I am Tiffany Schomer. I am the Tobacco Cessation Supervisor on the STEP team.
Thank you for joining us. Hi, Donna. Good to see you. You want to introduce yourself? You're in your car.
Absolutely. Yes, I am in my car. I'm Donna Viverette, she, her pronouns. I work with Jefferson County Public Health, and it's great to be here. Happy birthday, Raya, and all the others who probably have birthdays around now too. So celebrate. Thank you.
Thank you, Donna. Good to see you. And finally, Brittany.
I already introduced myself.
Okay, I'm sorry.
That's
you
okay.
did. You got on my screen
The other
twice.
Brittany over here too. So.
Oh, Brittany wrote. Okay, the other Brittany. Yeah. Oh, I got two Brittany's.
So I'm Brittany Lobato. I'm from Costilla County Public Health, and I do the tobacco prevention here for our county.
Okay. And Brittany, I may include you in the email to the Alamosa County project.
Okay.
Okay. We've got everyone introduced. Did I miss anyone before we move forward? Okay. Hearing none, we'll move forward. Okay, so today we're going to discuss secondhand smoke policies and HOA. Now, you're not going to learn everything today in 30-45 minutes, granted, but you should get a good start. So we want to open it up for community questions at the end, but remember this is going to tie into also session 3. So let me know if you get confused about anything or you wonder like what's my role in this. So let's go ahead and I'm going to introduce my partner here, Tobacco Manager Teddy. He already introduced himself, but Teddy and I have been working together on secondhand smoke complaints for about 8 years. He's been working way much longer, and I'll let him tell you that story. So not to steal your thunder, Teddy, go ahead, and I'm going to turn off my mic and give you the floor. Thank you again for sharing your knowledge with us today. We do appreciate it.
No problem. And Peggy, what view do you see on the slides? Do you just see the slide or do you see? Okay, sounds good. All right. Well, hi, everybody. As I said before, my name is Teddy Montoya. I'm the Tobacco Program Manager here at DDPHE. My pronouns are he, him. I've been in this work for quite a while now. My primary focus when I started in this work was actually systems change work and cessation interventions within the medical settings. And throughout the years, I've learned a lot in secondhand smoke and third-hand smoke related issues and responding to them here in Denver. So I'm going to kind of chat with you today about navigating smoke-free policies in HOA settings and how our response looks here at the City and County of Denver and what that looks like. Go to the next slide here. So here in the City and County of Denver, we are a complaint-based program. We don't have any local rules, regulations, or ordinances related to secondhand smoke or third-hand smoke in multi-unit housing settings. Because of that, we respond off of complaints that we receive. So where do we get these complaints from? They're from a different set of areas. We get complaints from 311, which is a telephone service here at the City and County of Denver, that if you have a complaint or an issue related to a wide range of things such as trash, the parks, potholes, secondhand smoke, third-hand smoke, etc., you can call 311 and open a ticket, and the city will follow through with resources or education or regulatory enforcement if needed. We also get complaints from tobacco-free COs. So like many of you, we receive complaints from CDPHE. And then we also get web-based complaints. And those complaints, I try to put the form in a screenshot here on the slide. It's a fairly long form, but we do get a couple complaints here and there on our web application related to secondhand smoke and third-hand smoke. And so where do they come from? For HOAs, they really come from three different sectors, so to speak: HOA boards, owners of individual units, or owners that may not be living in their units but be renting them out to other individuals, and then tenants who are renting those out from owners in the facility. So we get a wide range of complaints from those three primary audiences. So a little bit of understanding the landscape of HOA versus non-HOA here in Denver, and this will mostly apply for most of the state as well. So non-HOA settings are typically governed by local ordinances and housing provider tenant laws. Housing providers have direct control over their property's rules, of course within legal limits and what the state allows, but housing providers can implement smoke-free policies, both combustible tobacco products, vape, and marijuana, if they would like, within these private residential housing settings. And that can also be for public housing or affordable housing as well. Resident complaints typically are addressed directly with the housing provider, the landlord, or with local authorities if there's ordinances or regulations that are in place. In terms of an HOA, this is a little bit different. There's some key differences there, such as their legal structure and governing documents. HOAs have formal legal binding documents that can be amended to include smoke-free policies. It can be complex and often, requires a supermajority of votes. In most of the properties we work with, that can be anywhere from 60% to 70%. There are some instances where properties only require a 51% vote, but that's really unique to some of the properties. Talk a little louder. Sorry, I'm trying to be quiet at my desk. Peggy told me to talk a little louder. Try to be quiet because we have people in the office today. But non-HOA properties lack this individual structure. They really rely on individual owner decisions of that property. So if they're managed by a group or something like that, right? Whereas an HOA, these decisions are made by the collective body of ownership that live within these settings. So management and enforcement: HOAs have a board with the authority to enforce their rules, including potential smoke-free policies, whereas non-HOA really the enforcement relies on that individual housing provider. And then the scope of the policy also differs. HOA policies, once adopted, can be applied to a community-wide policy, which is mandatory with membership or living within that setting, right? Whereas in non-HOA settings, adoption can be voluntary and be piecemealed, and it doesn't apply to everything in some circumstances. And so HOAs are unique in the way they're governed and the way that policy is proposed and worked through. Both could be on similar timelines when thinking about implementing policy within these settings. We usually run on a 12-month runway timeline to implement a smoke-free policy if we want to do it the right way and with enough cessation resources and classes, etc. And that's both in non-HOA and HOA settings. But it's unique in how you offer these resources and information to both settings. And so I think the bottom line for us as grantees is recognizing that there's structural differences between the two, and that HOAs offer a potential avenue for really comprehensive smoke-free policies through their established governance. Whereas non-HOA settings require different strategies focusing on individual adoption and leveraging existing regulations within your city or authority. So how do we apply smoke-free policies to HOAs? Well, HOAs possess the legal standing to enact policies within their jurisdiction. These policies can vary in scope, covering common areas, specifically just common areas, or extending to individual units, patio spaces, parking lots even. The process for adopting these policies is usually defined by the HOA's governing documents. And so when you receive a complaint, it's really important to kind of understand the layout of the property and understand the governance of the property. When you receive a complaint, it's more than just asking what it looks like in terms of what you're being exposed to. The tenant or the owner, in this case, who might be having the complaint, really needs to get their governing documents, understand what nuisance clauses are in there. All these rules and regulations will be highlighted within those documents, and they really need to have a good understanding of what those documents are for a pathway forward in terms of, expanding to smoke-free policies or even enforcing current rules and regulations. It's also important to remember that while local ordinances set minimum standards and state law sets minimum standards, HOAs can often implement more stringent rules. And so when we work with HOAs, typically in the cases that we've worked with to expand policy in these settings, our policy has been bundled with some interesting rules and things like that. We've been paired one time. We've had a smoke-free policy on a ballot, and with that ballot, they were also looking to ban dogs in these settings, right? And so, they didn't want to allow dogs to be allowed in a specific building anymore. And so, with that, there was a lot of tension because of both policies being on this process. And so, it's really important to understand, the different, I don't know what the right word is, but the different policy related issues you're going to be dealing with outside of just secondhand and third-hand smoke related issues, if that makes sense. So I'll go to the next slide. So really navigating different tenures, rental versus ownership. You're going to get residents who rent or tenants of a HOA unit, then you're going to get owner occupied units. And so there's very distinct differences. And so you have to really distinguish between that rental and owner occupied units. Renters are subject to both their lease and the HOA rules. It really creates a dual layer of responsibility for a tenant in an HOA setting. And so, for example, a specific unit that a tenant might be renting out in their rental lease might say they have to be smoke free, right? But in the unit next to them, they might be in an owner occupied unit, and the HOA doesn't have any rules or regulations to prevent them from smoking in their unit. So the renter then would complain to DDPHE saying there's smoke drift in their unit. They don't understand why their unit's smoke free and the person next to them's allowed to smoke. And so we have to walk them through about why that is, what that looks like, and what are your options in terms of your living environment, right? And so we usually work with the HOA board at that point, getting the owner's permission from the tenant occupied unit to speak and work with the HOA board. I think that's really important in these settings, is we do need, the owner to advocate on behalf of their unit. We can't just go in and say unit 22B is being exposed. We want to resolve this. Because the HOA has a very specific governing structure, it's important that you work with the owner of that specific unit because they're the member of the building, if that makes sense. And so landlords often play a role in ensuring tenant compliance, right? They can make that unit smoke free. They can ensure that their renter isn't smoking and causing a nuisance to the neighbors, but that might not be the same case for an owner occupied unit. And so it's really a lot of communication and understanding the different pathways in terms of your response to a complaint that you receive in these settings. And HOAs are really unique, and they do take a lot of time and patience and practice. And so, if you are new to this work, don't feel like you have to understand the entire layout of this land. Peggy, Pete, and I are here to help support you guys in that. But I did kind of want to highlight that there are very unique differences between both owner-occupied and rental units in HOA settings. So, there's some practical strategies for addressing secondhand smoke complaints with HOAs. The important first step is thorough documentation of each incident. If you have a process established within your jurisdiction, awesome. Follow that like you would, an affordable housing or a market rate housing apartment complex. You would follow similar pathways there, right? It's really important to document and understand the situation. Residents should also be keeping detailed records of their exposure to secondhand smoke. This will help with their conversations with the HOA board in this process. And it's also really important to review the HOA's governing documents to understand any existing rules. And I wouldn't put that ownership on LPHAs. That is in ownership of the owner-occupied unit or the tenant working with their housing provider landlord in that situation. I don't want you guys to think you should be going in there requesting HOA documents, governing documents, and saying, oh, these are the pathways, right? We're not legal professionals. We're not here to provide legal advice. We're here to assist them and move them through what policy process looks like. And so if there's really, these really tricky policy related questions, they should either be working with some legal professional or they should at least look to understand the rules themselves because we can't provide that legal advice. At least DDPHE doesn't in this process. And the next step is really to formally communicate the complaint through the HOA's established process. And this is why I said it's really important for you to have, the owner as part of the process. You do need them to support you in the initiation and advocacy of a smoke-free policy. And then sometimes, mediation services really does help explore, resolve those disputes. I know and understand that all communities don't have mediation services to provide to these community, complaint-based programs. But I do think sometimes we do want to go straight to policy, right? We want a blanket policy, and that is best practice. We should be implementing policy in these settings. But, sometimes, policy takes a long time. It takes 12 months minimum, and sometimes mediation is a quicker path forward to resolve and reduce exposure in this environment. So we do often offer mediation dispute services to reduce the secondhand smoke exposure in that specific environment. So building on those initial steps, residents can also benefit from gathering support from their other affected neighbors. It's important to understand that HOAs, their potential enforcement actions. I think a coalition within these settings is really important. You have to get buy-in from your neighbors if you want to move a policy forward in these types of settings. And so working with the HOA board or the owner to get that support, to understand what a coalition building process is important, right? And then if the smoke-free policy is lacking or doesn't exist, grantees, we should really be empowering residents to advocate for themselves for those stronger rules. As an owner or tenant of those properties, they do have some power. They aren't beholden to, a property management company, for example. So they do have some say in this process. And finally, being aware of any broader local ordinances or legal protections is important. The Fair Housing Act, things like that, those can come into play when dealing and understanding and addressing really these HOA related issues. And so just some recommendations from our team and what we've tried to do, we try to acknowledge and validate, each complaint we receive. We take them all seriously. We acknowledge the health risks associated with secondhand smoke exposure. And we let the person who is complaining, regardless of where it comes from, that their complaint is valid, and we'll work with them to address the complaints. Now, obviously, we can't resolve every complaint. We can't move a policy forward in every sitting or situation. But it is important to acknowledge and validate the complaint because it does help in the long-term process and relationship building with community. Collect specific information about the nature, frequency, timing, and location of the secondhand smoke. I think gathering details is really important, especially if you start working with HOA boards. They're going to want to know who's experiencing it, when it's happening, how they can enforce it. Are they going to have to consider hiring, security after hours to deal with certain complaint related issues? A lot of properties already have that, and so they want to think about how they're going to address those things. So having as much information and data as possible is really important in the conversation and education build up in terms of this process. And then obviously we want, as public health, we want to educate about the risks related to secondhand and third-hand smoke, right? We want to provide clear and concise information. We want to emphasize that there is no safe level of exposure. And we want to share resources from reputable organizations like the CDC or the American Lung Association. We also want to maintain confidentiality, protecting the privacy of the complaint to encourage reporting and prevent potential retaliation. Now, this becomes tricky in HOA settings because you are going to need the owner's help to get to the HOA board, right? And so they're going to have to, they're going to have to kind of out themselves in terms of that. But if they have a tenant who is experiencing that, we can kind of mitigate that in different ways. So we want to maintain confidentiality, but we also understand that at some point we're probably going to have to expose and say, like, this building or this floor exaggerates what's experiencing a higher rate of secondhand smoke compared to other complaints we may have received in that building. And then documenting all interactions, right? Keeping thorough records of all complaints, communications, and actions taken. I think that's just part of best practice for us in terms of our reporting and our work with our secondhand smoke complaint program. We want to ensure that there's always follow-up, that we close out a case, that we understand some of the challenges and barriers from that case. So that way, when we have the next case, we can learn from the previous case. Like, what did we not do well, or what did we not do enough of that we can do next time or address in this next case, and go from there. And so really documenting all your interactions and how you navigate those challenges, barriers, and implementation of resources is really important. In addition, to the recommendations on the screen, I think it's also important to think about how we engage community in these settings, especially with some of the populations that, these are being exposed in these settings. I think it's really important to acknowledge that. We are going to have resources that might not be English preferred, right? They might need to be translated. We might need to have translation services and we educate owners in these buildings, because some of these properties, have higher rates of non-English speakers than other buildings, right? And so I think you have to understand the different dynamics and the community relationships within those, the dynamics within those settings, if that makes sense. And then the liabilities, potential legal liabilities to HOA boards. I don't think they understand, what they're risking or what they're doing by not engaging their membership body on secondhand smoke. It does open the door for them to be sued if they're not engaging with their residents, right? And unfortunately also residents are suing themselves if they are going to sue the HOA board. And that's the other tricky part. Like, if you feel like your HOA is not doing enough to protect you and you want to, and if they want to initiate a lawsuit or go through the legal channels, they also have to understand they're suing themselves, and they will, there are pathways where they'd be potentially liable for legal fees for things that they're putting against their HOA board, right? And so I think it's important to be very transparent and open about a lot of the things that they may experience in these, not to deter them, but to understand that this is a process and that this does take time, and that there's a lot of implications we have to be aware about when we're going through this process, right? And educating owners is a lot different than educating residents of a building, right? Owners are thinking more about their pocketbooks, how that impacts them in the long term, rather than potential health benefits or health related issues. And so, you really are going to have to think about your talking points when you're in these settings. People are going to, if they're renting out to residents, they want to hear about turnover costs. They want to hear about how that impacts their potential rental pool, et cetera. And so you have to have a different kind of language that's not so specific to health related messaging, if that makes sense. And then there's, legal resources. If you've exhausted everything, you can inform them that you can't do much more from here. They're going to have to seek legal guidance on where to go from here, because you've exhausted your education, the outreach you can do, et cetera, et cetera. Depending on your community, that might look different, but definitely, if you've exhausted all your pathways, there's still options and opportunities for them. If they connect with legal resources, there might be ways that they can motivate the HOA board more, if that makes sense. We've seen that in some communities recently. So there are some recent resources that I put in here. The model smoke-free Common interest community policy is really great from the Public Health Law Center. We don't have a model policy here in Colorado for HOA settings. So this, to me, in my opinion, is the best one to lean on when you're providing model policy to interested homeowners, interested HOA boards, etc. We don't draft the HOA policy. We really inform that they need to rely on their HOA legal representatives to do that. We provide them with this resource and they kind of go from there. And then there's also some legal resources for tenants or owners who, you know, through the Colorado Poverty Law Project, that if they need additional support that we can't provide them, we connect them with services through there or through our mediation partners at Find Solutions. So yeah, those are some resources. I think I sent them to Peggy, so she can include that in a follow-up email. But that is what I have for you guys today. I know it's not super deep, but HOAs are very unique. So
Hey, Teddy, could you open that Public Health Law Center link just to show them kind of the content that's in that document?
yeah, let me.
Is that asking too much?
No, let me get the hyperlink.
And I put in the chat, guys, settings. I did a kind of supplemental language. It's just more information that we couldn't really put in the training. So if you want to download that document, it's on how settings affect secondhand smoke complaint response. And there's HOAs and common interest communities at the bottom. So there'll be more details about how they affect policy and how they affect compliance.
I don't see a document. Does anyone see one?
Let me see. Did I not send it? Let me check. Oh, there we go. Got to push send. See. There we go. There. Do you see it now? Yeah, sorry. Okay, Teddy, go ahead and share this with them. Just
no worries.
Go over it so they know the content.
Yeah, no worries. So really this includes a policy that has cannabis, e-cigarettes, and combustible cigarettes. So I think this really applies to the communities we have here. But I will also be very transparent that any property we've worked with in Denver for an HOA related policy, they have no interest of including cannabis in their smoke-free policy. So I'm going to be transparent with that because those are the barriers and challenges we've experienced. It's like they will outlaw vaping, they will outlaw tobacco smoke, but they will not touch cannabis use because, and a lot of the feedback we've gotten is it's the only place that they legally can smoke by state law outside of the lounges, of course, but that they can legally smoke and they don't want to take that away from their tenant body. This has really become an issue in our senior communities. A lot of our senior communities have individuals who use marijuana for a wide range of medicinal purposes and things like that. And we see a lot in our senior communities that is something that they will not, that it's just not even a part of the discussion and conversation. And so I just want to be transparent for us in Denver. That's what we experience. But enough of that. So here's the model policy. Talks about all the things in here, about secondhand smoke and, the American Society for Heating, Refrigerating, Air Conditioning has issued a position document. To me, this is a really strong document. I know some of you have seen it. ASHRAE's, what is it? Peggy, what's the name of the place again? Is it ASHRAE?
ASHRAE.
Yeah, okay. Their document is really strong. But yeah, so it talks about the purpose, gives very specific definitions around business invitee, common elements, ESDs, what smoking is, what common elements are. The provisions is really specific, which is great. So yeah, some great resources. There's also some other resources in here, some Minnesota specific ones, because this is what this document was created for, but some very specific Minnesota resources that you may or may not want to look at, but national resources from the Cancer Institute, CDC, etc. But yeah, it's a good resource. I use it all the time in these settings. Encourage the team to use it all the time in these settings. But yeah, Peggy, was there anything else you wanted me to touch base on that document?
No, that's cool. I'm gonna just do a couple of highlights and then open it to Q&A. So if you could stay on the call, that'd be great. Teddy, do you have time?
Yeah, that works.
Okay, perfect. So let me just kind of put this into a little bitty ball for us to give you a starting point. Okay, so the priority for HOAs, two things, right? Well, four things. So do they have a policy or don't they have a policy? That's the most important thing, right? So then you want to know, are you a renter or an owner? Now, you cannot proceed until you know that answer. Those two answers you must have first. You must get that from the individual. Are you a renter or owner? And do you have an existing policy? That's important because that's going to determine which direction you go. Owners different than renters different. Caveat: time consuming. This is time consuming. This could be a year. This could be 2 years. This could be like Silver Creek, 5 years. So it's never over until the policy's implemented, right? There's always opportunity. So we also highlight that the smoke-free policy, a standalone policy, outweighs the rules. So the HOA board may adopt a rule that says you can't smoke in your unit, but it's not, until it's voted on by the owners, it's still subjective to be overturned in a legal matter, because the HOA board is deciding that, not the owners. So an owner can always go to court and say, I did not agree to this. This is my property. So they can really overturn that rule. And then I wanted to say the marijuana thing. This is how I get around it when I do my presentations, because Teddy's right. Folks, they buy condos, they move out of the state, and then they rent them out. It's land investment. And they think in their head, like, if I don't have smoking or marijuana, especially marijuana, then no one's going to rent my unit. So when I give these presentations to housing providers, to the residents, I ask them, have you ever Googled your property to see how it's listed on like these Airbnbs? Many people have condos and they put them on Airbnb, these rental sites. Some of them are really advertised as 420, 420, they have 420 patio, and they really advertise these rentals as a place to come and use, right? Which is not a bad thing, but it is if you live next door to that unit. So banning marijuana in the policy is important because you have that just in case, right? So if grandma's using, a little bit of marijuana at night to sleep, that's not as huge as 5 people coming from Ohio who's never used marijuana who want to smoke it up for the whole week, right? So you want to make sure you put that in reality to them. The policy has these things included just in case. So just in case it gets out of control, you can implement your smoke-free policy. So Teddy, I just want to ask real quick, with the HOAs, what role would the Colorado Clean Indoor Act play? And I know the answer, but I want you to, just in case you don't think I know.
Yeah, no. I think the Clean and Air Act only protects common elements of the building, right? If there's a shared laundry facility, the hallways, the elevators, etc. The Clean and Air Act does not expand into individual units. It does not expand into patios, with an asterisk, unless they're within 25 feet of the entryway, right? So there's all these different things you've got to consider when you visit the property, when you look at the property, because a lot of people say, well, the Clean Air Act should protect us, right? We shouldn't allow smoking within 25 feet of the entryway. Yes, but a lot of our HOA buildings are really massive in Denver, and so there's multiple entryways, there's multiple points of exposure that can happen within a property, and so the Clean and Air Act unfortunately does not give us indoor protections related to individual units and multi-unit housing settings. So it is tricky and it's unfortunate, but that's kind of where we're at in terms of the state policy landscape.
Thank you, Teddy, for clearing that up. So there also comes up with common elements. You heard that term, common elements. We're like, what's a common element? So that is really common areas, but that has come into play where patios have been in question of being a common element. I don't see they are. Again, it's a legal matter and it's under the interpretation of the lawyers from the HOA to really determine what the common elements are. But so let me just say the best way to address this issue in HOAs, the most forward movement has been by having these owners or renters submit a reasonable accommodation. So we're going to talk about reasonable accommodations and warranty of habitability in session 3. We have been having some good success because the reasonable accommodation says the person has a health effect. They can't breathe. So they, through HUD, can file a reasonable accommodation to the HOA board, and the HOA board would have to respond to that. That's where the HOA board starts saying, oh, maybe we are liable to the health of our residents and owners, right? So that's where that conversation of legality, what is the HOA's stance on protecting residents' health, and that reasonable accommodation is really like a wake-up call for them, because HUD will investigate and they will ask questions, and so that has moved to policy in one location. And so that's always an option. So just a plug there for session 3. I'm going to go ahead and open it up to questions and comments from the group. Please feel free. There are no, this is very confusing. And if you don't do this work, well, I don't expect you to know any of this. So there aren't any, there are not any uneducated questions. All questions are good. So let me open this up to you guys' thoughts and tell me what you think about HOAs and where's your confusion lies. And has anyone done an HOA complaint yet? Donna. Donna's got 4. Yeah, Donna keeps me busy and reasonable accommodation. Talk a little bit about the reasonable accommodation benefit of the HOA setting, Donna.
Yes, I was reflecting back on some of the early HOA complaints I worked with before really understanding the amazing leverage that the Fair Housing Act affords us. And so I wish I could call those folks back, from 10 years ago or 8 years ago, where I literally I was left with the feeling that there were no options for folks. It was like, you probably need to sell your unit or you need to find another place to rent. Anyway, but yes, so I have 2, one of whom was referenced earlier by Peggy, but is a person who has an owned condominium unit in Jefferson County as well as in Grand County. So, but I also have another person with whom I'm working right now who is a HOA condo owner in Lakewood. Both of these folks were dealing with cannabis smoke, and nicotine smoke, but and they both have had forward movement related to being able to make a request for a reasonable accommodation. And as a reminder, you don't have to be someone who is already getting Social Security disability income. You don't have to be someone who's a verified and long-term person with a disability. You can demonstrate that you have health effects or mental health effects related to the continuous exposure. That requires a physician or healthcare provider's kind of letter regarding that. But both of these folks have had forward movement. The one in Lakewood here is made a reasonable accommodation request to have the other unit sealed and her unit sealed. And they are she's engaged a third-party engineer to review like that as an option. The HOA board has accepted it so far. They also have a property management company that works with the HOA board, which has really been a bone of contention, I guess, or not a bone of, but a real source of pain for this resident, because the property management company is highly non-responsive and often treats her in a way that leaves her feeling really demeaned. So there's all that emotional aspect of it, not unlike other tenants of rented units, or folks we're working with in other housing properties. But she's awaiting the third-party engineering assessment as well as the property management company's building engineer assessment of the potential success of a full sealing of the 2 units. So she's hopeful. And because she has reached out to Colorado Civil Rights Division, the Disability Law Center, she knows her network now of supports for her. So I'll stop there, but it is very arduous. It's a long-term process, yes.
Thank you, Donna. And just to go back to capacity, like Donna said, this is a long-term process, but it doesn't mean you're doing the long term, right? The time's long, but you're not doing it the whole time. So please remember Teddy's caveats on what you can and what you should and shouldn't spend capacity on. So these are actions that the individual takes. We support them through resources and links and connections. We navigate it. We don't litigate it or manage it. Okay. So making sure you're not deep into it. Donna and I both have issues with it because we love to help the folks. We're like, oh my God, I got to help you. But it will drain you. And there's not a lot we can do, right? So it's just really important to understand like capacity. But I just want to make sure that we go back to our process, because if nothing else happens this year, I want us all to have a documented process in our files for the next person to follow. In this process, you'll want to give a process for the owner response and the renter response. So making sure that you address HOAs from both capacities. I want to give you a little, before we get off here, and I do want to shut up in a minute unless you ask final questions, but I want you to Google this address, because you're like, how do I know if it's an HOA or not? So Google this address. And this is our latest complaint from an HOA. 312 West Alabama in Fountain, Colorado. Nikita, what have you Googled it? What do you see?
I see a link to Zillow and apartments.com.
That tells you what?
That it's an HOA.
That's probably going to be an HOA, right? Anytime a unit shows up on Realtor, Zillow, whatever, that's your first clue. Okay, we got an HOA situation. So that's how you're going to know. It's always going to it's also going to be how you know if it's a home or a family, multifamily housing. So that's your first clue. Once you get that, you're like, oh, I forgot what they all said. So call me and we'll get started. Don't stress out. Okay, so just leaving the last 6 minutes for comments and questions. Interested to hear from our CDPHE folks who were just beginners in learning, Tiffany and Chelsea. Did you gain anything from this, or did you have any questions? I know you're looking to involve cessation into this process.
Chelsea, I'll let you go ahead if you'd like.
I don't have any questions right now. Still processing all of the information that was given. I think I'm just still new to this smoke-free world. So like Raya said, we've been working to link cessation with multi-unit housing, and what that looks like based on some previous projects that were a part of the portfolio in 2018. And we loved what was done, and we want to replicate it. So just trying to digest all of this information that can hopefully direct a few good projects in the next funding cycle. So thank you.
Thank you, Chelsea. And we do have cessation in every step of our 5-step process. We have those cessation resources. Tiffany, did you have any comments?
Nope, I'm just here to listen and learn.
Perfect, thank you. So let me don't underplay the role cessation takes, and I'll close with a story from Silver Creek. They're an HOA condominium setting, And they have several uses. They have HOA owner, renter units, owners live there. It's a hotel. It's a whole bunch of other things. They had a complaint. They always had complaints. We've had complaints since I've been here from Silver Creek. Casey Rose, who is a nurse, she's also a tobacco treatment specialist trained. She got in charge of this policy, of this complaint. And, you know, she went to the individual that the owner said he's smoking. I don't know how she did it. We'll have to have her tell her story one day, because I don't want you approaching people. But I'm sure they connected in a way through the HOA, and she didn't go knock on the door. So don't do that. But she's talked to the guy, and this would happen through mediation as well. We would invite them to mediation and have these discussions. But she said, you know, there's been a complaint, person's having issues, and he said, oh my goodness, I'm so sorry. Sometimes they really don't know. They don't know. And so she said, you know, we have some cessation resources, and I'm a tobacco treatment specialist, and I would love to talk with you if you'd ever thought about quitting, or maybe going outside to smoke, some behavior modification. He said, oh my God, he just had a health effect, something in his health happened that made him need to quit smoking. He said, I just had this health thing happen, and I've been looking for a reason to quit smoking. She engaged him as a TTS provider in cessation opportunities. He quit smoking. Now, this is like my dream, right? I probably will retire with this one story. I've got two stories, but this one is when it all worked right. So that's really what we want to build. We want to build systems that work right? That they address the correct issue, and they're given the correct amount of support with the correct amount of expectations. So anyway, that's where we're going. And I'm done for the day. Hearing no more any more questions or any comments in the last 3 minutes. Okay. Hearing none, I will say thank you for attending my Learning Community Call. This is the last in this year grant cycle, and we look forward to next year. Let me know if y'all have any questions. And again, I'll be contacting some of you about that opportunity in Keystone. Thank you so much. Hi, Donna.